Today we are doing some conversations about COVID-19, and I'm joined by Dr. Eric Bush, who's the Chief Medical Officer for Hospice of the Chesapeake and Chesapeake Supportive Care. So thanks, Dr. Bush, for taking time out of your crazy schedule to talk about COVID. So I appreciate you taking the time.
Thanks, Tammy. I think with the pandemic, crazy is the norm. So I think we've all accustomed to it.
I agree. All right, so we're talking about 5 things that you should know, and today's topic is vaccines. First of all, vaccine was developed very quickly.
Mm-hmm.
Should that be a cause for concern or worry for the public?
No, it should not. While we would always like more data, a greater number of participants in the trials, to me, the development of the vaccine so quickly indicates just the improvement in medical technologies over the years and the decades. And especially if you look at the efficacy or how effective the 2 current vaccines that are approved here in the US, both the Pfizer, BioNTech, as well as the Moderna, 95%, to me, that indicates just improvement in technology, not necessarily that anybody cut any corners.
Gotcha. So what about if you get the vaccine, could you get COVID from it? Is that something people need to worry about?
So again, back to the technology and improvement. With these particular vaccines, they're mRNA or basically protein vaccines. There is no part of the virus or killed virus or dead virus or anything like that. So no, it is not possible to get COVID from the vaccines.
Okay, great. That's good to know. Third question. So, and this is probably a tricky one. How quickly can people actually have access to this vaccine? And I know we're in Maryland, so for us, what's sort of how quickly can that happen if you want to get one?
It really depends on where you fall into stratification category with regards to your risk, whether you're a healthcare worker or not. If you're a healthcare worker, hopefully you've either received yours by now or you're at least getting invites to be able to receive that in the near future. Some other priority groups, I have a lot of patients that are immunocompromised in some way, shape, or form. Mm-hmm. They tend to fall in the 1B or 1C category. So again, coming into that time horizon should be soon. And it does vary from state to state. So for example, out in California, I know that even as of about a week and a half ago, they were immunizing employees of home health organizations that were not necessarily clinical per se. So it really depends on your local jurisdiction and where they are in that algorithm vaccine access to determine where you are in that pecking order, so to speak. Gotcha. Hopefully, it'd be great. The more people that can get it, the more we can get towards that herd immunity, so to speak. Really, the closer we can get back to some degree of normalcy in this country, things that are important like education. Being a father of 3 teens, I can tell you, I'd love my kids to go in person, at least part-time, but got to feel safe to be able to do so. So until the vaccine gets fully rolled out, so to speak, I don't see those things happening until that occurs.
Gotcha. I think you alluded to this, but number 4 question or topic when we're talking about what we need to understand, how many doses should one have to be effective for this vaccine?
Sure. So actually 1 dose of either the Pfizer BioNTech or Moderna vaccine provides around 60% immunity. But that being said, you want to get both doses. The Pfizer vaccine has to be 21 days apart in between doses. The Moderna is 28 days apart in between doses. I've been fortunate enough to have received the first dose. I'm actually scheduled for the second dose tomorrow. Okay. So yeah, you really need to get both doses. Now, once you get both doses, you have the efficacy is estimated at 95%, wow, which is really, really phenomenal.
Yeah.
If you think about flu vaccine, and we get that annually, efficacy generally somewhere in the 30 to 40% range. That being said, still need to get your flu vaccine because there's a whole lot of other benefits too.
Right.
So think about the same too with COVID, not just the benefit from COVID itself,
Mhm.
but if some variant of coronavirus comes out in the future that's somewhat similar, it should provide you at least some protection from that. And or if you do get COVID, even though you've had the vaccine, again, the chances of you getting a severe course are really a lot less.
Okay.
So there are, and same with the flu vaccine. So there's a lot of crosstalk, a lot of crossover, cross immunity per se,
Mhm.
that could be beneficial in receiving this.
Gotcha. All right, final question. So once we, let's say in a perfect world, we're all getting vaccinated, we have the vaccine, both dosages soon, do we need to stop being concerned or worrying about wearing a mask, washing our hands, watching our distance? Do those elements, those 3 Ws, still need to be co-occurring?
They absolutely do. And again, really until we get to a point, especially here in the US, from an epidemiologic perspective, that we have herd immunity and that the numbers have come down quite tremendously, because right now the majority of spread is in the community. So still need to wash hands, wear a mask, social distance. Those things should be ingrained in you until the foreseeable future. The other way I look at that question too is we, in the last 20 or so odd years now, have had SARS, MERS, COVID. There are some avian or bird influenzas that are still out there. France has recently had an outbreak of that. And given how frightening this current pandemic is, you never really know when the next one is around the corner. And again, I'm not being glass half empty here. I just want to say, given all that we've gone through and seeing the number of people and how much our country has been affected by this, you want to continue to do those things that we know that work, that we know protect you, that are fairly simple. I understand you get fatigued from adhering to them. I do too. You want to give people a hug every now and then, and that's fine as long as it's safe. But again, stick to washing hands, wearing a mask, and social distancing. Those are really essential for the foreseeable future.
Gotcha. Thank you, Dr. Bush. Thanks
Great.
for taking some
Thanks.
time to talk about the vaccine and giving us these 5 really important things that we need to understand and know about it.
Thank you.
I also want to thank the John and Kathy Belcher Institute for their generous support of the community education programs for Hospice of the Chesapeake. Thanks.